Allison is the executive director of Healthcare Network. And Allison and her team worked with the American Heart Association to staff to implement training around self-monitored blood pressure. Funding was provided through AHA and a chronic disease grant. Thank you for being with us today, Allison.
Thank you very much for having me.
Could you share a little bit more about what this program really is about?
Certainly. So over the course of the last year, we've had numerous engagements with AHA, and it's been a wonderful partnership so far. But what started us on this path is that as a free clinic serving Racine County, the low-income uninsured residents of Racine County, we have a disproportionately high number of patients that suffer from chronic diseases, mainly diabetes and hypertension. And as we work to really pull our services together to be a little bit more well-rounded and less disjointed for our patient population, we really were looking into new programs to be able to add to the medical care and the dental care that we provide in order to add this educational piece together. And so that's what had us looking at partnering with the AHA to begin with.
You know, when you look at the AHA program in itself, how is it how has participation in this program really impacted your ability to kind of deliver those services in the community?
You know, the grant, of course, funding as a nonprofit, and we're always looking for funding. Funding is always wonderful. But I have to say that one of the things that I am committed to as a nonprofit, as somebody who's been working in nonprofits for over 20 years, I really like to look at community partnerships and how when we put community partnerships together, it's more than 1 and 1 equals 2. It's more like 1 and 1 equal 3. So what can we pull together to be more beneficial for the community? And there's only so many dollars to go around, but there's a ton of need. And so the more that we can look at partnering together, the better off we are. So when we started this, we were really looking at how we can impact our diabetic and our hypertensive patients with some educational pieces that might be more of a one-on-one meeting sort of thing with our volunteer providers. And as we've gone forward with this project and move forward with AHA, we have now begun the self-monitoring blood pressure program here at Healthcare Network. And to have the guidance, so again, it's more than just the money, but to have that guidance with AHA, that information that was at our fingertips, the ability to pull up documentation on, hey, here's how you track this. We don't have an electronic medical record, so to be able to track it, to find easy ways to track this data, to have all of that available to us, and to have Tim and Obi available at the drop of a hat, it seems, and to be able to say, yep, here's that documentation, or here's the library, here's what's in the library, so when you need it, you can have access to it. It's been invaluable thus far, and it's just been a great year of a wonderful partnership.
Well, I have to say, you know, as someone who cares for patients with heart disease, self-monitoring of blood pressure is so vital because it's really giving the appropriate feedback to patients, you know, who get used to then measuring their blood pressure or their weight or whatever, to recognize when things are off and how they need to seek help. And so the more partnerships we can establish that really get the tools in the hands of people who need it most, and Katie's touched upon this, you know, especially in underrepresented, you know, classes of people, they have poorer access to healthcare, and that translates into more difficulty with monitoring and treating chronic disease. So with your work with the AHA, how do you see closing some of these health inequity gaps? These gaps are significant, and just listening to you, I'm excited about the work that you're doing to maybe close those.
Yeah, I think I guess during the time of pandemic, it's never been more highlighted, the equity gap that exists. And we've had so many of our patients come forward and tell us things that or make statements about their care that they might have gotten at the emergency room or at an urgent care center, where you're like, something was lost in translation. That's not exactly what's going on. And so we have learned we've known this, but it has been highlighted, like I said, over the past year, that the patients that we serve, which tend to be, again, they're low income, uninsured, and for the most part an immigrant population, that may not have English ability and are living in poverty, there is a huge piece of that pie that's missing in terms of translation. So in our community, we offer translation for services. When you go to the hospital and you don't speak English, you get a translator, but translator doesn't translate into interpretation, right? So we need to take that information and really help those patients understand what's going on. And that's what this grant and this project was all about. We had noticed that we had so many patients that were diagnosed with hypertension and diabetes, one or the other or both, and they had no idea what that meant. So they knew they had to lower their salt intake, or they knew that they couldn't eat as much sugar, or they needed to get this much exercise, or all those different things. But they had no idea how those things affected their condition and what their condition really was. So what we decided to do is implement one-on-one programs where we took a step back and really looked at those patients and figured out, how can we help you understand? And that light bulb moment where they're like, oh, nobody told me that's what happens when you have diabetes, or nobody told me that's why I can't have salt, or nobody told me what I could eat. They just told me what I couldn't eat. And so sharing those pieces and really having our patients have that opportunity to meet either one-on-one with a registered dietitian or a registered nurse, but also sort of meet in small groups with other people in their communities that have the same conditions, and be able to build that support network has been huge. Health is more than seeing a doctor or a dentist. It's way more than that. And that's what we were really trying to infuse with this partnership with our patients.
Allison, I can't thank you enough. As someone who, it's fine that we want to identify that there's a problem like hypertension or diabetes, but actually empowering people to understand their own health and what they can do to change their health is such a vital job. And so I'm thankful for the work that you do. And that's a large reason why I'm part of the American Heart Association. It's because we need these types of partnerships.